Which age group needs the most sleep? Adults, adolescents, infants, older adults. Correct answer is option C, infants. Normal adult urine output per hour should be at least 10 ml, 30 ml, 50 ml, 100 ml. Correct answer is option B, 30 ml. What is the normal pH of urine? 2 to 4, 8 to 10, 7.5 to 9, 4.5 to 8. Correct answer is option D, 4.5 to 8. Which oxygen delivery device gives the highest concentration? Nasal cannula, simple face mask, non-rebreather mask, Venturi mask. Correct answer is option C, non-rebreather mask. Which sign indicates orthostatic hypotension? Increased BP after standing, dizziness on standing, increased pulse while lying down, flushed skin. Correct answer is option B, dizziness on standing. Which lab test reflects protein status? Albumin, creatinine, glucose, bilirubin. Correct answer is option A, albumin. Which position is best for unconscious oral care? Supine, prone, lateral side lying, Trendelenburg. Correct answer is option C, lateral side lying. Which symptom is a classic sign of a heart attack in women? Sharp right-sided chest pain, sudden drop in blood pressure, tingling in the hands, nausea and jaw pain. Correct answer is option D, nausea and jaw pain. Which one color suggests infection? Pale pink, yellow, red, black. Correct answer is option B, yellow. Which position promotes lung expansion? High Fowler's, supine, Trendelenburg, prone. Correct answer is option A, high Fowler's. What is the purpose of anti-embolism stockings? Prevent edema, prevent pressure ulcers, reduce foot pain, prevent DVT. Correct answer is option D, prevent DVT. Perineal care is most important in which patient? One who is ambulatory, one with a catheter, one with short hair, one who is fasting. Correct answer is option B, one with a catheter. A clean catch urine sample is collected anytime after catheterization, midstream, first morning sample. Correct answer is option C, midstream. What is used to clean a fresh surgical wound? Normal saline, hydrogen peroxide, alcohol, none of these. Correct answer is option A, normal saline. Restraints should be removed every 8 hours, only after order expires, every 2 hours for assessment when the patient calms down. Correct answer is option C, every 2 hours for assessment. How long should a nurse wait after administering eye drops before giving another? 5 seconds, 10 seconds, 1 minute, 5 minutes. Correct answer is option D, 5 minutes. Which non-pharmacological intervention is best for acute post-surgical pain? Meditation, distraction techniques, ice or heat therapy, music therapy. Correct answer is option C, ice or heat therapy. Which bed position promotes drainage after abdominal surgery? High Fowler's, Trendelenburg, supine, SIMS. Correct answer is option A, high Fowler's. Which class of drugs is commonly used for severe pain? Antipyretics, opioids, antiemetics, antihypertensives. Correct answer is option B, avoids. Which condition most interferes with deep sleep? Constipation, sleep positioning, warm room, fan. Correct answer is option D, fan. Informed consent must be obtained by nurse, surgeon, family, pharmacist. Correct answer is option B, surgeon. The nurse notes red, irritated skin over a patient's sacrum. This is most likely pressure ulcer stage 1, stage 3 ulcer, contact dermatitis, fungal infection. Correct answer is option A, pressure ulcer stage 1. The nurse uses airborne precautions for HIV, hepatitis A, chickenpox, none of these. Correct answer is option C, chickenpox. Which is a sign of poor oral hygiene? Chewing gums, moist lips, clean tongue, halitosis. Correct answer is option D, halitosis. The legal term for doing good is autonomy, beneficence, justice, none of these. Correct answer is option B, beneficence. A nurse hears wheezing in a patient's lungs. This suggests normal breath sounds, fluid in alveoli, narrowed airways, atelectasis. Correct answer is option C, narrowed airways. A patient receiving morphine complains of constipation. The nurse should reduce fluid intake, avoid all physical activity, stop the pain medication immediately, increase fiber in the diet. Correct answer is option D, increased fiber in the diet. Which sign is an early indicator of depression in the elderly? Insomnia, weight gain, fever, none of these. Correct answer is option A, insomnia. The best way to confirm nasogastric tube placement is injecting air, checking aspirate pH, asking the patient auscultation. Correct answer is option B, checking aspirate pH. Which solution is used for hand hygiene when hands are not visibly dirty? Water only, soap only, alcohol-based sanitizer, disinfectant spray. Correct answer is option C, alcohol-based sanitizer. Which is the highest safety risk for an elderly patient with dementia? Poor appetite, fall from bed, medication refusal, dry skin. Correct answer is option B, fall from bed. A pulse oximeter measures blood pressure, heart rate, respiratory depth, oxygen saturation. Correct answer is option D, oxygen saturation. A nurse is removing PPE after care. What is the correct order? Correct answer is option A, gloves, gown, mask. Which food is highest in iron? Orange juice, milk, spinach, rice. Correct answer is option C, spinach. Which is a normal finding in a healthy adult's urine? Fruitine, glucose, blood, clear pale yellow urine. Correct answer is option D, clear pale yellow urine. A sign of IV infiltration is red streak along vein, bleeding from IV site, swelling and coldness at site, none of these. Correct answer is option C, swelling and coldness at site. Which finding is abnormal in a post-operative patient? Absent fetal pulse, drainage on dressing, mild swelling, slight discomfort. Correct answer is option A, absent fetal pulse. The best time to document patient care is at the end of shift, after the patient is discharged, immediately after care is provided, whenever there is free time. Correct answer is option C, immediately after care is provided. Which PPE is essential when caring for a patient on airborne precautions? Surgical mask, N95 respirator, gloves only, gown and goggles. Correct answer is option B, N95 respirator. Which value indicates adequate oxygenation? Correct answer is option D, SpO2 is equal to 95%. Thanks for watching. Subscribe to the channel for the latest informative MCQs.